Hello, it's Julie from Lady Vits Physical Therapy, and I'm making this particular video series because I've had some requests to talk about sciatic pain and different ways you can help yourself with sciatic pain. So this is one I know really well because I dealt with it from my first back injury in my early 20s all the way through my entire 20s until my early 30s when I finally figured it all out and got the healing that I really needed. And most of it was physical therapy, so thank goodness for all that. So let's get into it. So what is sciatic pain? This particular video is going to be addressing the herniated disc sciatic pain situation. So there's a lot of different things that can cause sciatic pain. You can have a super tight piriformis muscle putting pressure on the sciatic nerve. You can have stenosis, and I'll do a separate video about that. This particular video is really just to address those people who know they have herniated discs, who haven't stumbled upon this solution. I'm not going to take any credit. This is not my solution. This was discovered by Robin McKenzie in Australia many years ago. So this is really his approach to, and he's since passed, but this is his approach to dealing with disc herniations and sciatic pain due to that. So let's get into the anatomy a little bit because it's really important to understand what's really happening. If you have a herniated disc, what does that mean? So we have our spine and we have these nice little discs between each vertebra, and they're not really hard plastic like it's in this model. They're a little more squishy, and they have to obey the laws of fluid dynamics, and they have to respond to pressures inside these discs. It's all about shock absorption. Well, what can happen could be a disc herniation. So this model has a pretty horrific depiction of it, where it shows this disc kind of poking out, suddenly turning red for whatever reason, and potentially pushing on this nerve. So that can be why you have nerve pain shooting down your leg. What caused it? How do we fix it? So that's where I'm hoping I can shed some light on this. If you know it's due to a disc herniation, and you've had everything else ruled out, but no one's taught you this, I hope this helps you. So basically, if we know there's something sticking into that space, there's something sticking out back here, pressing on the nerve, you're gonna have nerve pain. It can be just shooting into your butt cheeks, it can be going halfway down your hamstring, or all the way down to your toes. I've experienced all of it. It can feel numb, tingly, achy, cramping, shooting, all of those things. It can skip your thigh, only feel it in your calf, or it can skip your thigh and your calf and you're only feeling it in your foot. So I've been through all that. So you're not alone. These things really can get better. So I want to explain what caused it to go that way so that you can understand how we're going to bring it back the other way. So these discs are responding to pressure. So if you flex forward, what's going to happen? Well, as you can see, if I flex this spine forward, there's a lot of pressure on the front of the disc. A lot of pressure. And say you have a desk job and you're sitting all day. Who sits with perfect posture? Nobody, not even me. So if you're slumping at a desk all day, that's a lot of pressure in the front of this little disc. And if you imagine this disc like a kind of a thick water balloon, if you squish one end of the disc, the fluid has to go somewhere. So if you're sitting slouched, or say you do a lot of lifting during the day, say you're lifting your kids 100 times a day, or you have a heavy lifting job, or you're picking up the house after your kids and you're bending over a lot, or you picked up something really heavy once. that was my mistake. So there's a lot of different ways. It could just be prolonged sitting. You have a driving job, you have a desk job, you're in grad school. There are so many things that can cause too much pressure on the front of this disc, and it responds and it squishes the other way. So you can get some pressure squishing towards the back. And there is a ligament that's meant to design to hold that disc in place, but like any ligament, it can be stretched. So we have both a ligament injury and we have a disc squishing into this space, pushing on the nerve. So we have to address both aspects. We've got to get the disc back where it belongs and get the pressure off the nerve, and then keep it there for 6 to 8 weeks so that ligament back there can finally heal. There's this posterior longitudinal ligament that runs right back here, and it really helps to seal the discs in, but I know I've blown mine out. You can. So understanding the factors that causes this herniation, we have to be mindful of when we sit. Are we sitting with good posture? Are we upright, or are we slumped? You know, we're not just sitting at work at the desk, we're sitting when we eat meals. I mean, sitting is such a huge part of our lives. So What is your posture when you're sitting? How often, how long are you sitting? Are you doing a lot of lifting? And think about those repetitive flexion moments to your spine. So if you've gotten yourself in that particular situation where that's been your lifestyle and you've had this injury and you know because you got it diagnosed by a medical doctor, I am not diagnosing anything on this video, and you've had your diagnosis, now we need to be mindful to stop doing those repetitive activities that make it worse. And how do we reverse the pressure? Because luckily your body's designed to heal, thank goodness. And it can if you give it the opportunity. So if you know you do a lot of sitting, or it gets worse when you sit, or you have a desk job, you might need to buy a little like foam roll for your low back to stick in a chair so that you can keep this nice little curve in your low back when you are at a desk, so you're not like this. So you might need to stuff a towel roll or something under your back to keep this nice little curve in your back. And we'll go over lifting mechanics later. But let's think about how we're going to put the disc back. So the same way it got out of place. So it got out of place with this repeated forward flexion. And you can see even in the model, you can see all the pressure that's going on the front of these discs. Unfortunately, because they're not plastic, they're not squishing back to show you what they would do. But normally there'd be some displacement. You'd see some pressure changes. So we're going to go the other way. If you notice from a herniated disc, we need to go the other way. We need to take gravity out of the picture, take all the pressure out of the system, and we're going to go the other way. So I like to explain to my patients, watch your kids because they've not been injured yet. Watch what a healthy body does in a 24-hour day. Children are all over the place. They're not just like us adults. They're not sitting or standing or walking or laying down. Children are hanging all over the couches. I mean, they are all over the place. But really what they're doing is they're giving their spine full range of motion in every single direction with full rotation. They're using every force all day long. It's really not until we get stuck in these kind of, for me it was school, you know, you're just sitting all day. So there's different things that cause, I think, our bodies to go in this direction. But I like to say, look at kids, look at how they move, because that's the goal, to have full range of motion and pain-free movement and great strength. So we're going to be a little more kid-like. So in this approach, and this is not, again, this is not my school of thought, this is what I've learned, we're going to use extension to essentially tuck the disc back in the other way. Because it was flexion, either one big huge flexion event or repeated flexion, that made it move to the back. So we're going to use gentle extension to help it move back up in front and get that pressure off the nerve. So no matter where your nerve pain is, anything I recommend in this video should help you. If it doesn't, don't do it. Just don't do it. This is not one of those things where, oh, maybe if I do it more, I'll get better. No, you should feel the difference right away, and if not, don't do this. So I just want to preface anything from this point on is, if it hurts, don't do it. Go seek a professional. So moving forward, we're going to figure out how to get you into extension. And that might sound really scary because if you've had this pain, it's very counterintuitive. When your back is spasming, and oh my goodness, I remember when my back was spasming. When your back is spasming, all you want to do is bend forward and help lengthen the muscles. So intuitively, you actually want to come forward more. And I remember doing that all through my 20s with my herniated discs and all the nerve pain. I was always bending forward to stretch my low back, and in a moment it felt good, but everything always came back. So what's happening is your muscles are spasming in your back because your body's trying so desperately to protect you. So your body knows there's an injury back here, you've got nerve pain shooting down your leg, and your muscles are spasming. So it might sound counterintuitive to want to actually go backwards, but if this is the right move for you, it's actually going to feel much better. So what we want to keep in mind when we have a herniated disc and nerve pain is the goal is always to make it better. So if you're starting off with nerve pain that's shooting all the way down to your foot, you're always going to start off before you do these movements asking yourself, how does my pain feel? How far down my leg is it going? Because that's your baseline. And then you're going to try these movements, maybe 10 or 20 reps. And then you're going to stand up and say, how does my pain feel? And how far is it going? So what I typically see in my office is someone might have pain shooting all the way down to their foot or their calf, and I have them try a few of these moves, and then they stand up and they say, oh, it's not down in my foot anymore, it's only halfway down my thigh. And I say, let's do the moves again. And we do the moves again, they say, the nerve pain is gone. So that's about the direction this should go. It should be quick, you should know right away if it's going to be helpful, and you should get relief right away. So I'm going to demonstrate these movements in the order of the most severe pain patient or someone at their worst where I have been, to someone just kind of generally doing maintenance for their spine to, prevent a reoccurrence or just to keep healthy range of motion. Okay, so getting into the movements, how are we going to tuck this little disc back in? So for someone who might be feeling very symptomatic, say you're in a lot of pain and you're a little bent over already and you definitely cannot stand up all the way straight, obviously you can't start flat on your belly. So if you're in that much pain, I'll grab an extra pillow. We're going to start out with a couple pillows under your pelvis. So very carefully, and I know I'm doing this without pain, but very carefully climb on board a couch or bed with 2 pillows under your pelvis. Go ahead and gently lay down. And now just let gravity do some work. Wiggle your ankles back and forth. It's going to help relax your low back. So you can wiggle fast, you can wiggle slow. If you have a very good friend who can put their hand on your back and give you a gentle wiggle in your spine, it will just help to start to bring motion as lotion. So you kind of want to lubricate the joints to help get things moving. So if you've been in a lot of pain, this is a really good place to start. Just on your belly, as many pillows as you need under your pelvis, and just let gravity do the work as you wiggle your ankles. So it's kind of nice to start here, even just for 2 or 3 minutes to relax and help the back relax. And then we move into the extension. So from here, once things have calmed down, you move into the extension. So the rule is it's not allowed to hurt. You're never allowed to feel the pain get worse. You need to stop if you feel that. So what I like to say is hands under shoulders, turn your butt cheeks off, really relax your butt cheeks, and use just your arms, and you press up in your pain-free range of motion and right back down. Pressing up, staying entirely in your pain-free range of motion and back down. You never push into a pinch, ever. You never push into feeling like it's getting worse, ever. You stay only in your pain-free range of motion, which you might find as you go on and you're noticing I'm doing, it seems to be increasing as I'm going. And that's really common, that usually by the 10th or 20th repetition, you have more range of motion. And what that's representing is it's representing you're actually doing the physical work your body needed. You're actually motioning the spine and getting it to tuck back in. So that's kind of step 1. You relax, you wiggle your ankles, relax your butt, and you try 10 or 20 repetitions in your pain-free range of motion. You may not be able to do this because things are really painful. I've had patients where I start them here and I say, let's just push up from the shoulder girdle, just using the shoulder muscles, because that's moving the low spine. And there's some people where that's where you need to start, and that's totally okay. You gently move into greater range of motion as your body allows. Maybe this is all you can do for a little bit. Maybe eventually you come out here and you get a little more movement. So you have to listen to your body. Now, when you've done 10 or 20 of these, the next question is, was that the right move for my body? And did that work? So I recommend gently, slowly come on up on all fours. If you're someone that has pain shooting down the left leg, don't get off on your left leg. Instead, get over on your right leg and transfer all your weight on your right leg to get up off the table. Because I never recommend transferring all your weight to your painful leg. That doesn't feel good. So then you stand up and then you ask yourself, how do I feel? Same, better, or worse? You might even check your range of motion coming forward, coming backward, to the side, and to the other side, just to see, wow, I'm moving better than I did before and I'm having less pain. Now, if that's your outcome, congratulations, that's the right movement for you and your body's saying thank you, and keep going. So the way I was taught with this method is you do as many repetitions as your body needs to heal. So if you feel better after 20 reps, maybe 50% better, go do 20 more. I've had some patients that need to do 100 repetitions to make it all feel better, but it worked, and your arms, they get exhausted, but it works. So you start with the smallest dose and you see how your body responds to that dose. Maybe 10, maybe 20, and if that makes your symptoms 50% better, try 10 or 20 more. You repeat that press up motion until you've plateaued or you're 100% better. Say you've done 30 and you plateau and you say, gosh, I'm 75% better, but I did another set of 10 and I'm not any better, then you're done for now. You got your medicine dose your body needed now. And then you come back in 2 hours and you do it again. So this gets annoying, but you do it every 2 hours. That's the medicine, is the movement. Because you know you're probably gonna end up sitting and doing some bending activity, and you're gonna need to help tuck things back in. So this is difficult to do first thing in the morning. Everything's stiff, don't even worry about it. Wait till your body gets moving a little bit in the morning, you've moved around, so you can start your latter morning with it, and then every 2 hours you can continue to do the motion your body is responding to. Now, once you get to the point where you can lay flat on your belly and you don't need pillows anymore, fantastic. Pillows are gone. And then you do the same motion. So maybe you never even needed the pillows. Maybe this is where you start. And this is totally okay. Starting flat on your belly is a great place to start. And again, sets of 10 or 20, and you ask yourself, am I the same, better, or worse? If you're better, you do more. If you're worse, you stop and don't do any more. Ever. If your body gets worse, that's not the right movement for you. And if you're plateauing, you can stop there and come back 2 hours later and do some more. So it's really about listening to your body, and that was the right move for my body. The pillows didn't feel so great, but that felt really great for my body. So again, it's every 2 hours while you're symptomatic. What symptomatic means is you've got nerve symptoms. So we're trying to go from what we call the peripheralization, or the symptoms moving from your back going all the way down your foot, and we want centralization. We want the symptoms coming all the way up your leg and going to where they belong. So something you might experience when you do this, I certainly went through it, a lot of my patients do as well, is what we call centralization pain. So when you first start, you might only have sciatic pain but no back pain. And then you do these movements and your sciatic pain gets better, but suddenly you have back pain. Congratulations, you're on the right track. So that means your pain is becoming centralized to where the problem actually belongs. So it seems counterintuitive. Well, why, if this is helping my back, makes my back hurt? And it's all about the brain and perception of pain, and that's a whole nother video series. But basically, if we get the pressure off the nerve and the nerve pain is gone, then the only thing you can experience is the localized inflammation that still remains and healing that still remains to be done. So every 2 waking hours, come on, let's be real, we can't always do it every 2 hours. Some people it's every 3 or every 4. Good enough, you do what you can. But about every 2 to 4 hours, you give yourself the press-ups that you need to minimize your symptoms, as minimal as they will go. And you do this every day, and as the days and weeks go by, you'll find, I don't have pain anymore, hopefully. If that worked for you, congratulations. You can stop doing your press-ups and cut down to maybe just once or twice a day for maintenance, because the truth is, as adults, look at me, I'm sitting with terrible posture. Do I need to do press-ups every day? Yes, at least once at the end of the day, just to relieve the pressure that's been built up in the front and tuck things back in again. So I usually say once you've been pain-free, no nerve pain, for at least 6 weeks, then you can slack way, way off on those press-ups. Because if you've been symptom-free for 6 weeks, that means you've kept that disc in the space where it belongs, which means the pressure has finally been taken off, that posterior longitudinal ligament. We need that ligament to heal. So it's one thing to put the disc back in place. It's another thing to have that ligament heal and seal it in place. So I like to say, don't ignore your symptoms. If you're only doing your press-ups every now and then and you're fluctuating in and out of symptoms, that ligament can't heal. But if you're really staying up on your press-ups and you get to the point where you've been symptom-free for 6 to 8 weeks, now you can trust that that ligament is healed. You can trust that you're ready for the next step. Stabilization and increased range of motion, all that good stuff. But for that healing phase where you're doing the press-ups and you're controlling your nerve symptoms, you're avoiding bending over too much because you don't want to undo the good work you've done. Now we all have to put on our socks and we all have to tie our shoes. So there's some bending over, but maybe you're mindful. Maybe you're going to bend at the knees and not at your hips, so your back doesn't have to flex so much, so you can do more of a squat motion. So for as long as it takes to get you symptom free, you're going to keep doing those press-ups. I'm trying to think if I'm forgetting anything. This is just to address the nerve pain. This isn't addressing all the stabilization you're going to require. That's a whole nother component to healing. but I've had so many requests for sciatic pain, and I know this is so common, and having been through it myself, I wish someone had made this video for me over 10 years ago. Could have saved me about 8 years of chronic nerve pain. I think that's it. So I hope you found this video helpful. It was really, really long. Thank you for sticking with it. The number one rule is never do anything that increases your pain, ever. So this video is for information. This video is for education. However, if you're not my patient in my office, I cannot treat you or give you medical advice. So I'm hoping that this information and education was helpful for you. Please don't do anything that doesn't feel good in your body. And again, just gently put it back, stay with it, let that ligament heal, and then you can get on to reintroducing flexion, because it doesn't mean you have to spend the rest of your life not bending forward. It just means for several weeks you're going to be super mindful about it and really careful and cautious and do as little of it as possible. There's so many other videos and topics we can make about this in terms of back supports and cushions and sitting postures and squat techniques, but I'll save that for another time. I hope this was helpful. Thank you so much for watching. Have a wonderful day.